Hi, I'm Samar Sallam and I'm presenting our exploration of viewers' emotional reactions to health-related data videos and how those emotional reactions are related to the viewer's willingness to adjust the related health behaviors. Data videos are short videos containing motion graphics with visual and auditory stimuli to tell a story centered around data. They are becoming increasingly popular in recent years because of their narratives or stories, which can quickly convey information to anyone regardless of their data literacy levels. The story component of data videos can effectively influence the viewer's emotional experiences or affect. Research shows that viewers' affect to a multimedia play an important role in the appeal and persuasive power of the media content. However, not everyone reacts in the same way to affect-inducing stimuli, so personalization of data videos might be important. However, there are no studies empirically examining viewers' affect in the context of data videos. So we ask two questions. How do viewers emotionally react to data videos given their personality differences? And what are the factors that contribute to the persuasive potential of data videos? And our ultimate goal is to deliver design guidelines for developing powerful health-related data videos. For this, we conducted two online studies. Study 1 is an exploration of affect, personality, and the potential for attitude change. With MTurk, we administered a survey which contained 9 existing data videos on 3 common health topics. We asked 3 questions. Does increasing viewers' negative affect levels lead to higher potential persuasion? And we focused on negative affect as we noticed that the majority of health-related data videos use a loss-framed messaging strategy focusing on the negative outcomes of failing to follow the healthy behavior. The second question is to examine the potential link between participants' personality traits and their affective state. Finally, we explored the predictors of potential attitude change. With the following scales, we assessed participants' personality traits, their affective state, the general persuasive potential of each video, and participants' evaluation of the video content in terms of the information novelty, clarity, and usefulness. Prior to the video viewing, we assessed participants' demographic information, personality traits, and affective state. Then participants watched a video. Subsequent to the video, they completed questions about general persuasive potential of the video, their affective state, and content appraisal. Each participant watched one video for each topic, so they repeated the sequence after the video viewing 3 times in total. We recruited 102 participants who varied in their gender, age, and education level. To explore our first research question, we used a simple regression analysis and found that negative affect negatively predicts GPP. This implies that when participants' negative affect were high, they were less willing to alter their related health behavior. Next, we explored the link between experienced negative affect and participants' personality traits. We found that negative affect is positively correlated with neuroticism while negatively correlated with conscientiousness, meaning that highly neurotic people experienced higher negative affect by watching data videos, whereas with the same stimuli, highly conscientious people experienced lower negative affect, confirming that people react to data videos differently based on their personality traits, pointing towards possibility of effective data video personalization. With a multiple regression, we also explored what predicts general persuasive potential of data videos. Only information usefulness and neuroticism predicted GPP, explaining about 66% of the variation in GPP. As we can see, information usefulness in particular is a strong predictor of GPP. Finally, we closely examined data videos that induced the highest and the lowest negative affect. It turned out that that one video, along with the other 2 videos that induced the highest level of negative affect, included fear-inducing messages without a clear solution. As a result, participants' negative affect remained high after the video. So we further explored the link between negative affect and the presence of a solution in data videos in the next study. Thus, with our findings, we moved to study 2. Based on study 1, study 2 explored the effect of including solutions in data videos. We hypothesized that by having clear solutions, the viewer's anxiety levels can be eased as they feel the issues are manageable. This drop in anxiety level should then boost the persuasive power of the video. A between-subject study with 3 video conditions was conducted. The base of all videos was created by the WHO and it focused on physical activity. While the beginning part of the video was identical, each video had different ending. The first video stated the issue and the threats of physical inactivity, but did not introduce any solutions. The second video ended with a general solution, and the last video ended with a concrete solution. We recruited 119 participants from the US and Canada. Participants varied in terms of their age, gender, and education level, and they were almost equally distributed among the 3 conditions. In study 2, 2 scales were added. First, perception of own health to measure participants' assessment of their own physical activity level, and a set of actionability questions to measure the video's actionability. Participants started with demographic questions, then the personality items, followed by the health perception questions. After that, they were randomly assigned to one of the 3 video conditions. In all conditions, participants' affective reactions were measured once before the video viewing and again at the peak of the video. For the 2 solution conditions, participants responded to the affective state questions for a 3rd time after the solution was provided. After completing the video viewing, participants answered the actionability questions, GPP questions, and the content appraisal questions. For the analysis, we started by exploring if data videos with solution are perceived as more actionable. As the graph shows, videos with solution, either general or actionable, were perceived as significantly more actionable than the video without solution. Interestingly, we didn't find significant difference in terms of actionability between the 2 solution conditions. To explore if actionable videos or videos with solutions are more useful, we entered actionability as predictor of usefulness in a linear regression, and actionability did predict information usefulness, meaning that the more the videos were actionable, the more they were perceived as useful. Then, we tested if information usefulness still predicts higher persuasion using a simple linear regression, and information usefulness was interestingly again a very strong predictor of GPP, explaining 78% of the variability. Then, we examined the effect of adding a solution in reducing participants' anxiety levels. A linear regression analysis confirmed that the video condition predicted the drop in anxiety levels, meaning that when the video provided solutions, anxiety levels declined. Then, consistent with study 1, the drop in anxiety predicted higher persuasion potential. So, adding solutions to data videos makes them more effective in reducing viewers' anxiety levels, and that in turn predicts higher persuasion. Finally, we investigated for personalization. Consistent with study 1, we found that neurotic tendency was linked to high anxiety levels, whereas conscientious tendency was linked to lower levels of negative affect. We also found that when participants perceived themselves as less physically active, they experienced higher levels of negative affect by watching a data video explaining the dangers of physical inactivity. To conclude, based on our findings, we share some guidelines for developing effective data videos. In terms of the content and narrative structure of the videos, we recommend that health-focused data videos should include concrete solutions to the presented issue with practical and useful information. That would lower viewers' negative affect and boost the persuasive potential of the video. While adding detailed solution is optimal, if the video length is an issue, while not ideal, adding a simple solution would also improve the power of data videos. And regarding viewers' personality, designers should be cautious with the amount and level of threat when targeting individuals with neurotic tendencies or those who are vulnerable to the issue discussed, as they tend to be more sensitive. Thank you very much for listening.